All right. Thank you, Michelle.
Okay, so we are now recording, and you can see my slide. So, the security rule is really in depth. And as we talked about, we are going to be going through a slide deck that has a lot of information in it. And we did that purposefully so that you can actually, when you look at the slide deck and hear the recording, it might make more sense to you. The main concern of the security rule is to implement effective risk management so that we can absolutely make sure, or try to, as most as possible, make sure that the information is not used or disclosed to unauthorized people. So it is really important that we understand what the security rule is and what we have to do to make sure that we look at the risk management as it is for our organization and make it as precise as possible. Now, the HIPAA security rule, as we talked about when we were doing the privacy rule, it affects the covered healthcare providers. And the providers, of course, are the doctors, the nurses, physicians, labs, etc. But where we stand is that health plan, that self-funded health plan. And we have to protect the information that is created or received by that health plan. And then the health plan clearinghouses. I do not think that you have a clearinghouse component to your organization. There are some implementation specifications for that as well. And when we get through that, we'll just skim over those because I don't think it applies. But a clearinghouse is a public or private entity that processes another entity's healthcare information and puts it in the proper format. When the HIPAA security and privacy rule came down, we wanted to make sure that we used ICD-9 codes and CPT codes and that everything was standardized. And on the back end, believe it or not, there are some codes too, like a code that says I am transmitting a claim or I am inquiring about a claim. And the clearinghouses are what do that. And there are some standards for the clearinghouse, or if an organization has a clearinghouse component, but I don't think it applies to you. And then they did add another covered entity under HIPAA, just to let you know, and that was for the Medicare prescription drug card sponsors, and that was included when we did the Medicare Modernization Act and added prescription drugs. But again, where we live and breathe is going to be that health plan. Now, there are basically three things that we always look at when we look at any of these security standards. We have to look at the confidentiality. Absolutely, we want to protect that confidentiality of information. But we also want to make sure that there is integrity with the information that we have in our systems, that the information hasn't had an unauthorized change to it or an unauthorized deletion. And again, the example I always use is, can you imagine if you paid a large health claim, somebody deleted that, and then they issued a payment to another agency or to another organization or potentially to themselves. So we always want to make sure that that integrity of the system is there as well. And then finally, the availability. Now, if you were a large medical center, availability would have to be 24/7. Because you are a health plan and that you're looking at it from a health plan perspective, you would have to determine what is reasonable for your organization as far as availability is concerned. Could you be down for 3 days without any really bad side effects? Would it be 1 day? What would be that if you had a hurricane come through or a national disaster come through? What would you have to do for the availability? But we always have to make sure that the systems are available and up and running within a reasonable time frame for your organization. Now, the HIPAA security rule is also organized into three different primary areas, which we're going to go through. And we talked about these when we did the HR training. We have the administrative safeguards. And a lot of the administrative safeguards are those safeguards that we have on paper, but that paper is very, very important. And that's where we have the risk assessments and the risk management tools, and also where we look at a lot of HR policies and procedures as well. Then we have the physical safeguards as to what the building looks like, what the physical workstations look like, where that information is, and who can have access to it. And then we also have the technical safeguards, which is what the IT people work on very hard on the back end to make sure the integrity and the availability and the confidentiality of the systems. That's where you'll find standards such as encryption. So we always want to look at that as well. Now, there are other couple of things that the HIPAA also says is that we have organizational requirements. And when we talk about organizational requirements, those are the business associate agreements. We talked about some business associate agreements before, that if you have a third-party administrator, that's your business associate, and you must have a business associate contract in place. And the reason that's really, really important is because if that business associate has a breach and you do not have a business associate contract in place, then the Department of Health and Human Services is going to come after you for that breach and fine you. If you have a business associate contract in place and it can be determined that it was solely the responsibility of the business associate, then the business associate is going to be the one that the Department of Health and Human Services comes after. And finally, under the security rule, like everything else, we need to have policies and procedures and documentation in place. For an example, if you have a patch that needs to be done, and then when you try to implement that patch, something else goes awry, so you're making an exception to that patching process, you would need to have an exception log as to why you did not do the patch as it came down the pike. So again, the security rule does require a lot of documentation. Now, when this security rule came down in 2003, and we implemented it in 2005, the Department of Health and Human Services gave us a very broad stroke of the pen as to what we needed to do. They broke those 3 safeguards down into standards, and then those standards into what they called implementation specifications. And they're still existing today, but as we move through those standards and those implementation specifications, we realized that a whole lot more guidance was needed, especially as security is an ongoing target, that things happen every day. So basically what happened is frameworks appeared, and frameworks were basically telling more details as to what we actually needed to do in order to protect the information. Now, the 3 main frameworks worldwide is, number 1, comes from NIST, and NIST is the National Institute for Standards and Technology, and that's the United States, and it's a quasi-governmental agency. And basically what they did is they put together a risk management framework just for HIPAA. So that's basically what most HIPAA-covered entities follow. If you were an international organization and you had a lot of international business, there was another standard called ISO, and that's when they had a framework very similar to NIST, but it branched out more internationally to cover all the international laws. And then finally, not too many moons ago, there was another company that came in, and it's called HITRUST. And HITRUST came in with another kind of framework, and it's really on a really high enterprise level, real expensive, really for the really big conglomerates that might deal more with every single law out there in the book and internationally. So they put together HITRUST for that. But as we go through this, what we deal with HIPAA typically is the NIST standards and the risk framework. And as again, the NIST stands for the National Institute of Science and Technology. So basically NIST always started with, and FIPS, when you see FIPS at the top there, basically what that stands for is the Federal Information Programming System. So that it does, tell you that, hey, we're looking at this from a federal point of view, which HIPAA is. And the 800 series is specifically dealing with HIPAA. And SP are special publications that they wrote regarding HIPAA. So they always said the first starting point with the framework is to categorize the systems, then to select the controls that you want to implement, then implement the controls that you have, then assess the controls to make sure they're actually working, and then authorize the system, send it out to all the users, and then monitor and control it. So if you look at NIST, this goes around in a great big circle, so that we're constantly monitoring what we're doing, and we're constantly checking to see the things that we implement is the things that are really good for us.
In the old lower board. Cool, thank you. All right, bye.
So one of the things that we want to make sure with the NIST system is it consists of 6 steps that are paramount, and we just went through those 6 steps to make sure that we do implement it, and we do implement it appropriately. Now, this first step, and we're going to go through each of these steps, is the categorization of the information systems. Do you know where your systems are, and have you determined the criticality and sensitivity of the information and the information being processed? So for an example, in the HR that has the systems in place for the protection of the HIPAA information, for the protected health information, what systems do you use? What kind of payroll systems do you use that might have that information in it? What kind of systems do you go back and forth with your TPA? So you've got to determine what systems you're actually using and the criticality of that system. And then just for the IT's reference points, the links to it are actually the law that goes with it. So it's under section 164.308A, and I just wanted to make sure that we had, as I said, this information is enough that you would be able to actually look at it. The second step is always select the security controls for the information that you've identified, for those systems that you've identified, and that you always want to tailor them to meet the business needs and to address the level of the risk associated with that business need, and then applying them effectively to determine the security control and the baselines. So that's the second step. Once you've identified the systems and the criticality, then what are the security controls you're going to be looking at? The third is to implement those security controls. Once you've established what you want to do, then you have to implement them. And of course, the goal is to make sure that the security codes that you have selected during the second step is actually meeting the requirements once you've implemented them. And of course, always when we implement anything, we always want to assess it to make sure that when we actually evaluate it, it's doing the job that we wanted it to do. And then the next is we also want to authorize the information system. We want to pass it out there, and we want to make sure that the system is actually accepting these controls and that it's pushed out there to the users. And then finally, monitor. Monitoring is really important. We always want to make sure that the systems are monitored and that the things that we are doing to secure the systems are actually working and that we are meeting the required purpose. So with that being said, that is the broad category of how the NIST framework works, that we always want to establish it and then monitor it. But when we break down the security rule, and again, those administrative, technical, and physical safeguards, and then break it down into the standards, what we always want to do, and this is how we set up this program, is we want to break those standards down so that we understand what the government is requiring of us and the explanation of the key activities and the guidance questions that the government asks, that we ask of ourselves within the system. Then we want to implement it and carry out the key functions as to what is required of us. And then we also want to be able to prove that we have done what the Department of Health and Human Services tells us to do. So whenever we go through these standards today, you're going to see that we want to understand it. You're going to see how we implement it. And you're also going to see a way of proving that you've done what you said you were going to do. And that's when the documentation becomes all important. So let's start with the administrative safeguards. Now, the administrative safeguards have more safeguards than the physical and the technical. It is the biggest starting point when we talk about HIPAA. And the first standard under the administrative safeguards is the security management process. This process is the cornerstone of HIPAA. It is something we absolutely have to do. We have to understand it, and we have to be able to prove that we have it. And basically, there are 9 key activities. The first one that goes along with the risk assessment plan, is that we have to identify our systems. If we don't know where our systems are, we don't know what we have to protect. And then once we identify our systems, who has access to those systems? So that's what we do when we conduct a thorough and accurate risk assessment. We have to know where the systems are and who has them. That is the first step. Once we do a thorough and accurate risk assessment, and we're going to be talking about that in a little bit, we have to look at the risks and determine within our organization what risks are acceptable to us. We have to have a risk tolerance level and what risks are not. So we have to implement a risk management plan in order to determine how we are going to manage the risks that we really need to manage. We are going to have to acquire the IT systems and services that are things that we have to have. We are going to have to create and deploy policies and procedures to make sure not only are we doing what we say we're doing, but we have documented it. And we also have to make sure that our employees are actually following the policies and procedures that are implemented. So for an example, one of the things you might have is an acceptable use policy. I'm giving you access to this system. The property belongs to Delaware River. This is what I expect you to do with the system, and these are the things you can't do. And again, so it all comes down to when we create these policies and procedures, we absolutely want to make sure our employees are following them. How do we do that? Well, we develop and implement a sanction policy. And that sanction policy can be a tiered policy, and we'll talk about that. But again, if the employees aren't following what we're telling them to do, there has to be a sanction in place. And yes, human resources is very much involved in that process as well. Then the other thing we have to do is we have to develop and deploy an information system activity review process. And we're going to be spending some time on this. For those that attended the HR training, you remember Anthem, that the server was attacked, that the information, the server password was obtained, and information was leaving the system on a regular basis. And it took the IT department 4 months to realize that 75 million records of individuals were stolen. So how do we make sure that we catch that quickly? And the only way we can do that is by system activity review. And then we always want to develop those operating procedures and standards so that we have it in writing what we're doing, because that's part of the proof. And we want to always review what we have in place to make sure that it is actually working. So with that being said, with security management, let's take a little bit of, and again, these slides have a lot of information because I wanted them to be usable to you at the end of the training. So basically what the National Institute for Standards and Technology said when it came to conducting a risk assessment, it said you must conduct an accurate and thorough risk assessment of the potential risks and vulnerabilities to the confidentiality, integrity, and the availability of the electronic protected health information. And that's what we have been talking about all along. We have to not only protect the confidentiality, but we have to make sure we have the integrity and the availability as well. And then what NIST said is you can ask yourself in your organization these various questions when you start looking at a risk assessment. And then some of the questions that you would ask is, do you have a prior risk assessment? Is there any kind of intelligence available from the Office of the Inspector General or from other vendors? What are the current plans and controls that you have in place? Is the facility located in a region that might be prone to national disasters like earthquakes, floods? Has responsibility been assigned to check all this hardware and software, including hardware and software for remote access? So this is where you've got to know who has access to what, if it's remote, and again, most of us are remote now because of COVID. And then the other thing we always have to make sure that don't forget to include those laptops and cell phones because they're very, those are really high key items that can get lost or stolen. So we always want to make sure we have that as well. And then when we talk about the laptops and cell phones, are you using laptops and cell phones that belong to Delaware River, or are people bringing their own device? And if they're bringing their own device to the picture, do you have a bring your own device policy that they understand that you can look at it and potentially wipe it if it has information that they shouldn't have on that? And then where are the analysis for the current safeguards and their effectiveness? So not only do the risk management plan, you have to look at your hardware and your software, you actually go through all the standards that HIPAA provided and that NIST provided, and where do you stand with each of these standards and where your risks are. So really the risk assessment details everything that HIPAA incorporates. And then you also want to make sure that you have processes in place whenever you're creating it, receiving it, maintaining it, or transmitting it. So these are the questions that you have to ask in order to really understand what you have to do with the risk assessment. Now, the other thing is the definitions. You know, a vulnerability is just that. It's something that makes you susceptible to a potential threat. And that threat is when there could be an intentional or accidental triggering that exploits a vulnerability that you have in place. So the vulnerability is not the threat, but it leads to the threat. And then the risk is when you look at the threat and what could happen. Is it a high risk that it's going to happen? Is it a low risk? And then also what information if it is a high risk, what would the impact be? Would it be a low impact? Because potentially you have a high risk, but maybe none of the EPHI would be taken because the risk is elsewhere. So you always look at not only the risk and what the impact would be, but you also always look at everything else that goes along with it. And then, of course, we're always looking, because that's what the government tells us to, and it only makes sense. We're looking for the confidentiality, the integrity, and that availability. So not only are we assessing the risk for confidentiality, but also for integrity and also for availability. So then they said, okay, so now you have to implement it. What can you do? Well, the first thing they say is clarify the scope of the assessment. And in HIPAA, the scope is we're not concerned about all your business practices. We're concerned about the electronic protected health information that the department, the HR department might have as it relates to your health plan. Again, I always say HIPAA makes a really good business plan as well. So if you have other things you want to protect, take a look at HIPAA as well if you have business secrets and see how you would go about implementing this for that as well. And then, gather the data that you have already got. You've already done risk assessments before. If you know where the systems are located, gather all the information that you always have. Identify and document the potential threats and the vulnerabilities. Where are those vulnerabilities that could lead to a threat? And if you remember in the HR training, we talked about vulnerabilities for COVID. You weren't wearing a mask, you weren't social distancing, you weren't protecting yourself, and that could lead to the threat of developing COVID. So the same thing with the systems. Where are the vulnerabilities that you have that lead to a potential threat? And then once you have that threat, what is the impact if that threat was exploited and you would have a breach? And again, determine the likelihood of the occurrence and determine whether it would be high, low, or medium risk. And then also look at the impact. If this was to happen, what the impact to the organization would be as far as that electronic protected health information. So it's a lot of information. Basically, it says you have to do an accurate and thorough risk assessment. And then you implement it, you get all this information together, and you determine where your risks are, and you assess your current systems that you have in place. You might want to implement additional security measures after you do this, and then you always document your findings. So once you determine what you need to do, then you implement it. You've got this risk assessment now, and then proving it. Department of Health and Human Services comes in, and they say, prove that you've done a thorough and accurate risk assessment. This is where the paper comes in. You're going to be able to show them the risk assessment. You're going to be able to show them these were the threats and the vulnerabilities that we discovered. We've assessed the level of those vulnerabilities. We've now started to work on our risk management plan, and we're talking about the measures that we are going to be working on to implement so that we can reduce the risk. And, we've done all this work, and here it is. This is something that the Department of Health and Human Services has always said is not being done. And whenever they go in, because there has been a HIPAA breach, this is always the first thing they ask for, is that risk assessment. And 35 to 40% of the time, the organization does not have it. But if you don't have a risk assessment, you don't know where your risks are, and you can't really move forward with HIPAA. So the first and the cornerstone of HIPAA is that thorough and accurate risk assessment. Now, once you have a risk assessment done, then you've got to manage those risks. You look at the risks that are high impact and high likelihood, and what are you going to do to manage those risks? So the first questions you always ask is, do the current safeguards that you have in place looking at your risk assessment actually protect that confidentiality, the integrity, and the availability of the electronic protected health information? Do current safeguards protect against reasonably anticipated use or disclosures that are not protected by the privacy rule? Now, of course, remember in the privacy rule, we are allowed to use the information for treatment, payment, and healthcare operations, and we're allowed to use it for authorization. We have an authorization. But have we protected it from use or disclosures outside of those guidance that the Department of Health and Human Services gave us? And has the covered entity protected against all reasonable anticipation of threats and hazards? And has the covered entity assured compliance with the policies and procedures in the workforce? So again, we've got this risk management plan. How are we managing it? And are we doing things that are reasonable to our organization? If you can remember, we talked about MD Anderson Hospital, and with MD Anderson Hospital, and for 6 years in a row, they said our biggest threats are these laptops and cell phones that aren't encrypted. And every year that was their highest risk on their risk assessment, but they never took care of it. So when you're looking at this, it was very reasonably anticipated that something was going to happen when they had all these unencrypted laptops. They never took care of it, even though it was reasonably anticipated that this was their biggest risk because they said so. And then at the end of the day, 7 years later, they had laptops stolen. So again, the Department of Health and Human Services say that if you have a risk assessment, which we are requiring you to do, then you have to really take that risk assessment, look at your vulnerabilities or threats, look at what is reasonable to correct and what is high that has a high impact, and correct it, because otherwise there's no point in having a risk assessment. And again, for the risk management program, suggestions for implementing it, take a look at those risks and assessments and what you've done. Years ago, Medcom used to have on our physical risk assessment, we had a key code that we would get into the offices, and we punched a key code, and it was the same for everyone. It was never changed, and it was an old antiquated system, and it was hard when people left to actually change the code because it was so antiquated and it wasn't always done appropriately. And then 5 years ago, we said, we just can't do this anymore. It's on our risk assessment year after year. We've got to do something. So we actually got a key fob method where now we just everybody has a key fob, easily terminated, cancel when somebody terminates. We can restrict access, so people can't get into our server room without the proper key fob card. So we did a lot with even simple things like that, but it was on our risk assessment and we didn't need to take care of it. So how do you prove it? Well, again, it's documentation. All the changes you make in your organization that has to do with the risk assessment or the risk management plan, every time you change something or you upgrade something, document it, keep that log. So when the Department of Health and Human Services come in, you can say, yes, I have a risk management plan, and this risk management plan is a living and breathing document, and we are constantly upgrading it, and we're constantly looking at it, and we're constantly doing things. You can't get credit for something that you don't write down. You've got to be able to show it. So again, risk management plans should be living and breathing so that you can actually prove that you're following through with the risk management plan. Sanction policies, I think, speak for themselves. We have to always make sure we have sanction policies in place in case that somebody is not following our policies and procedures. So can you lay your hands on a sanction policy? And is it properly applied so that it doesn't matter who you are in the organization, you have to follow that policy? And then, make sure that the sanctions are clear and that they are spelled out, that individuals know that, for an example, you are not allowed to download games on the computer. Somebody downloads a game, that it's swiftly and appropriately taken care of, and that everyone has actually signed off on the policies and procedures that they understand. So documentation and proving it is pretty easy. Keep a record of all employee signatures agreeing that they will abide by the policies, and keep a record of the individuals who have violated the policies, if they do, and what you've done to correct it and what sanctions you imposed. So again, it's really important that if we've gone through all this work in IT, that people with access to our systems, workforce members with access to our systems, actually abide by it. And the same thing, this is to activity review process. Basically, this description says we must implement procedures to regularly review the information systems activity, such as audit logs, access reports, and security incident tracking reports. You have to make sure that you have somebody who's overall responsible for this. How will the reviews take place? How often will the reviews be analyzed? What is the organization's sanction policy for employees who violate? And where will the audit information reside? This can be a difficult standard for some because their systems may not be set up appropriately for audit control. But we learned with Anthem that this was really, really important. And as we said, this is the area that Anthem failed because for 4 months, information was leaving the system and they didn't identify it. So we always have to make sure that we do have audit controls in place. So one of the suggestions to do that is potentially to get a security information event management system, or maybe some other solution that you might find so that you can keep track of user IDs, dates and times of logons and logoffs, IP addresses of the accessed and successful or unsuccessful login attempts. If somebody is pinging at our computer, we always want to know about that, or at our server. Ideally, the record should be automated with security personnel being alerted if activity that is indicated is out there. I will tell you that we did get a security information event management system at Medcom and installed it so that we keep a daily track of everything that's coming in and out of our servers. Our servers are encrypted as well, but we wanted to make absolutely sure that our IT guys are able to monitor and able to monitor appropriately. And again, depending on your company, policy reviews can be conducted continuously or whenever a complaint is received. As we talked about, it's always important if a complaint is received that it is thoroughly evaluated and what steps should be taken in order to make sure that there was no tampering. You know, we learned a lot from Anthem when they had that big breach, and auditing is so important to know where people are with the systems. I know in hospitals, they also have, information to who logged into what record, and they know instantaneously if I would be logging into a record that belonged to one of my relatives or to a movie star or something like that. But in our business, in the healthcare plan, it's not as, we don't have that kind of sophistication, and nor should we. We're not a big medical center, but we do need to make sure that we are taking control of the system and we do know what's coming in and leaving. So how do you prove it? Again, documentation. Create policies, how you monitor the system, create policies for log reviews, create policies for defining who's responsible for looking at this information, create policies for protection steps. So if you do find that there has been something that happened that's untoward, and publish all the policies and procedures so that the next people coming in can make sure that they understand what had been done in the past. And you also want to make sure that individuals know that, the systems are being monitored, because if they know that systems are being monitored, especially for those potential purposeful threats, that they might decide not to take that risk. Now, again, we talked about this with the privacy rule, and in the security rule, you have to have someone who is going to be the security officer. And you have to, assign a security officer, the person that's going to take absolute control to making sure the systems are safe, those systems that, the HR department are using when they are looking at their HIPAA. And then you have to assign that security responsibility. So there's 5 activities regarding, and then the next one is workforce security. Sorry. Security, assigning the security officer doesn't have anything specific with it. The next standard is workforce security. And basically what we want to do here is implement policies and procedures that ensure all members of the workforce have appropriate access to the systems, and that the workforce members that we give have appropriate access. Now, HR plays a huge role in this as well, and this is where HR and IT really need to talk to each other. Things that we need to do is implement procedures for authorization and supervision. So, for an example, HR hires a new individual. They have to let IT know what systems they need access to. It should be geared to the job description. So you have to have a clear job description that says, hey, you're going to be doing this, and because you're doing this, you need access to this. And establish the criteria for hiring, because we always want to make sure that we're hiring the right people. And I hate to say it, there are a lot of people that, if you don't do a criminal background check, might not be the people that you want touching your systems. So again, what are your policies for hiring, firing, and establishing this clearance? And how is that relayed to the IT folk? So you want to make sure you have chains of commands and line of authority, and that they have all been established, and have the staff members actually been made aware of the identity and roles of their supervisors, so that they know when to go to the supervisor if something comes up. So when we're looking at the authorization for use of the system, look at who's going to get that EPHI, what supervision is required if they do get that information. Define the roles of the supervisor in handling the EPHI. Define the qualifications for filling those supervisory roles. Select who your supervisors will be, and then make sure that they are introduced to the staff. And I have to say here too, the privacy and security officer should be very visible, and all staff members should be aware of who they are as well in case there's an issue. Proving it, again, policies and procedures. What are your policies for hiring? What are your policies for termination? How do you relay that information to your IT folk so that the IT folk give the proper documentation? And then at the very end of the day, how do you audit that? We had the case in Florida with the hospital that we talked about, where for over a year, the individual had been terminated, but nobody terminated the system's access. So, and then there was finger pointing. IT, HR said they gave it to IT. IT said they never received it. And that can happen. But there should be a follow-up. There should be, a month later or 2 weeks later, that you do a systems run and you check to see who has authorization to what, and that name should not be on there. There should always be those regular intervals and things going on. And again, these are all the workforce clearance procedures that we've talked about just now, and the termination procedures, same thing. Access management, a lot of this has to do with the clearinghouse. And again, I do not believe that you are a clearinghouse, so we don't have to isolate the clearinghouse functions. But we always want to make sure that we give access only to those that are supposed to be given access. So we'll forget the clearinghouse because I don't think that applies to you, but we'll provide it to you just in case there are. And again, access management. We always want to make sure with access management that the people have the specific access controls. Do you have the job descriptions in place? How do you grant the access to the systems? And we have talked about that when we did the other ones. Now, the big one here is security awareness and training. And we talked about this during, the HR training, and I believe that you're using KnowBe4, which is really, really good. But you always want to conduct training and needs assessment of your workforce members to make sure that they understand what the security of the systems should be and that they understand things that can come in as well. You want to develop and approve any kind of training strategy and a plan, and I know you have a plan in place. You want to protect from malicious software, login manage, and this comes in with login managing and password management and making sure all those are in place as well. It's also where you might find your antiviral protections and things. But again, training is very, very important. Implement the training. Implement security reminders so that you always have people thinking about security, and always monitor and evaluate your training plan. So questions to ask yourself: do the workforce members know the importance of timely application of systems patches to protect against malicious software and exploitation of the vulnerabilities? Do they know that when they're working remotely and you push through a patch, that hopefully it's a mandatory patch and it just goes through the system? But if you have any kind of security updates, do your employees have to implement those immediately, turn them off, make sure at night that all the security things go through that you are implementing? Are they aware that login attempts may be monitored so that, after a certain time, if you've had more than 3 login attempts and you fail, then the system could be locked down? Do employees that monitor login attempts know whom to report the discrepancies? And again, everybody can type in something wrong on their password. What we're worried about is people trying to get into the system. So we always want to make sure we do have those passwords. And do employees understand their role and responsibilities in establishing a password? And how do you monitor that as well? If they put in a password that is not of sufficient character or, sufficient degree for your security purposes, are they allowed to change the password, or do you block it if it doesn't have the appropriate number of characters or, uppercase, lowercase numbers, etc.? I think that you've got KnowBe4, which is great, so they always say consider purchasing modules to protect the system from malicious software. Force the group policy, forcing system updates on a regular basis. Monitor the login attempts, and train security team how to spot discrepancies. So if you hire more IT people as well, make sure your IT folk are knowing what they are looking for at the same time. So how do you document this? Well, again, logs, training logs, show the logs that you might get from KnowBe4, and document all reports of malicious software when the employee fails to report that. So we always want to make sure that we've got communication with our employees, that they report anything that might be untoward. If they make a mistake and they send it to the wrong person, we need to know about that. But again, documentation is completely the key to this. And again, security reminders. How do we keep the employees engaged so that they are always aware of what they need to do with security, so that, you know, they're fully aware not to click onto a bad link, or that they know that they, you know, have to, you know, implement the security protections that you tell them they have to implement, that they're not allowed to download certain games or certain malware, or they're not allowed to visit certain sites on the internet. So how do we do this? And again, with all new training people, with all new people that come into HR and have access to electronic protected health information, are they given this information right up front with the new hires before they actually look at protected health information? But with this kind of security reminder, it's not just for those that have access to the protected health information. If you have someone that's on a global platform, and that platform could potentially, you know, cross over into the HR systems, you always want to make sure that all employees do not contaminate your systems or your servers. And again, are security topics reinforced during staff meetings? How often do we talk about security? It should be discussed regularly with employees. They should be talking to their supervisors and managers and bringing all their concerns and questions to date too. And how do we document it? You know, just keep track of all those messages that are delivered, keep track of everything that we do in regards to training and security reminders and onboarding and new hire training and everything that we do. Our staff goes through HIPAA training the first day that they come into the office, and they have to look at all our policies and procedures. Then they have to go through know before training. So they don't even start working typically for 2 to 3 days, because the first few days are just full of security training. Now, security incidents is very, very important. And we talked about this when we talked about HR. And it is what happens if there is an incident. We don't know if it's a breach yet, but there is a suspicious incident that might have happened. And, you know, how do we handle that? And there are 4 key activities: determine the goals of the incident response, develop and deploy an incident response team. And I know that Andrew was establishing that incident response team. Develop and implement procedures to respond to and to report security incidents. And then at the very end, after everything is said and done, look at that post-incident analysis and make updates and revisions. So for an example, again, I'll use Medcom as an example. You know, we noticed that, we had a couple of incidences where people were sending information to the wrong email address, where Susie C. Smith popped up instead of Susie Jones. And so they sent it to the wrong person. And we have this whole incident response team, and we looked at this happening. And at the end of the day, what we want to do is process improvement too. We didn't have a breach. Everything was taken care of, but we needed to do it. You know, how do we protect this? So now you have to literally click on the name before the email is established. So it takes that one extra step now in order to get an email put through. But again, all these security processes that we want to make sure that when we go through the process, we're also looking down the road. As the Supreme Court would say, is this capable of repetition? So we always want to make sure if it's capable of repetition, we look at something that might prevent that repetition. So again, whenever we talk about a security incident response, some of the questions we have to ask ourselves is, has the organization determined that maintaining a staff security incident hotline would be reasonable and appropriate? Has the organization determined reasonable and appropriate mitigation options for security incidents? Has the organization determined the standard incident report templates to ensure that all necessary information related to the incident is documented? Always good to have a checkoff sheet in an incident so that you make sure you have all the information. Has the organization determined under what conditions information relating to a security breach will be disclosed to the media? And as we talked about with the HIPAA training, 500 or more in a location, you got to report it. And has appropriate internal and external persons who have been informed of a security breach been identified? So if you actually do have a breach, you got to notify the individuals. And has a written incident report plan been put in place so that once there is an incident, the whole team gets together, you know exactly what you're looking at. You're looking at to determine whether or not it was a breach. And then if it was a breach, how do you notify all the right people? So you have, so suggestions, of course, create your procedures for responding to incidents. Assign a team leader. Assume somebody has to take control here. Otherwise, everybody will be pointing at everybody else. So always assign a team leader. Train your team, train your backup. Issue copies of the procedure to the team and their backup. Practice, practice, practice so you know what to do. Evaluate the procedure regularly. And create procedures for implementing changes. Things happen all the time. And as we talked about with NIST, with that whole cycle, not only do we implement it, but we're constantly modifying it to see what works and what doesn't work. But incident response is absolutely critical. And I will tell you that when Anthem happened and the IT people were asleep at the switch for 4 months before they realized all these records were going. Once they recognized it, their incident response team reacted momentarily, and the Department of Health and Human Services gave them a lot of credit for that they had a plan in place. They knew exactly what they were going to do, how they were going to do it, and they got it done. So anything that has to do with an incident response procedures should be in writing. A master copy should be maintained at all times. Changes, whenever you make a change, make sure that you document the changes. Don't destroy the original. The Department of Health and Human Services and the OCR and everybody loves it when they see process improvement. So again, adjust it, amend it, show where the changes are. But again, don't destroy the originals. Just make sure that you have a whole history of things that it was to begin with and things that you are moving to now. And then like incident responding, contingency plans are also important. Incident responses are when, we have an incident that we've got to respond to, that it potentially is a breach, and how do we respond to it? Contingency planning, and you'll see this throughout HIPAA, has to do more with the availability of the information. What happens if we have a national disaster? We had COVID. What happens and how do we make sure that the operation continues? So you have to develop a contingency plan. You have to conduct an application of the data criticality analysis, which means what systems are important. If we were to have a hurricane tomorrow and your whole HR department was wiped out and your whole building was wiped out, what systems would be the most critical to get back? Number 1, 2, 3, 4. So do a data criticality analysis so that everybody knows exactly what they're going to do. Identify preventative measures, develop a recovery strategy, have a backup plan and a disaster plan, develop and implement emergency mode operations, and then testing and revision. Now, when we talk about testing and revision, it doesn't mean that you have to actually crash the system. You can do it at tabletop. One of the things our IT department did for our contingency plan team, never did we expect COVID, by the way. That wasn't part of the equation. We have an organization we deal with that we can, if our building was to cave in, we would go, we have this organization that we engage and they would set us up with temporary residencies. They knew exactly how many computers we would need. They knew where people were living, so where we would set up the best office space outside of the flood zone or whatever we were in. They did a lot of work for us, and then COVID hit and none of it came true. But again, testing and revision, you can do desktops, tabletops. Our IT guys trained us as to go in, for the team that is on our incident response team, what server trays we need to keep in criticality or take first, second, third, and fourth, so that if we had to move them out of the building, which ones we need to take and how to do it, so that we're all trained in case that happens. So again, what hardware, software, and personnel are critical to your daily operations? What is the impact or desired outcome available? What is any support provided by external providers, i.e., we have this organization that we deal with, and what is the nature and degree of the impact on the operations? So you always have to determine what's first, what's second, what's third, and what's fourth. Take stock of your operational systems, rank them based on their criticality, and rank them on the compliance needs. And then document in your incident or your contingency plan what you're going to do, who's going to do it, what's going to happen. And if that person that's supposed to do A, B, and C isn't there, who's going to take the place of the person doing A, B, and C, so that you have backup to the backup. But again, whenever we talk about contingency plans, it runs throughout HIPAA. We have to have a backup plan. And data backup is important, and the disaster recovery plan. It all goes in with contingency planning. So where are your formal policies? Who has access to the data in that case? And always have redundancy when it comes to communication. Inevitably, something will happen and somebody doesn't have access. So we always want redundant connections, data backup to different geographical locations. Now we have the cloud as well. And always implement a plan for people working remotely. And I think that we've done a pretty good job on that with COVID. Again, when we come back from that disaster and we're all getting back into the office, we have to test the recovery of the systems. It's one thing to shut them all down. Now we're bringing them all back up, and we have to test the recovery and document what our findings are. And then develop an emergency mode operational plan as well. Have procedures been developed to continue the critical functions that have been identified? Again, we have a company that backs us up. But we always have to know what those critical functions are. And we have to do, as part of our risk analysis, what is our risk tolerance? How long can we be down? And, develop the emergency mode. Again, with everything with development of emergency mode, documentation is really important. Who's going to do what, when, and how we're going to test it. And the testing and revision procedures. And then again, with anything that we do, we always have to do an evaluation. So no matter if it's the training that we're doing on our staff, if it's, we've assigned a security person and then that person leaves, whatever we've done, we have to continuously evaluate it. We want to make sure that our internal and external systems are working appropriately. We want to make sure that what we have put in place is actually working. So we have to make sure that we continue to do that. So with security and with risk management, it's always this circle going around that we're constantly reevaluating to make sure that the standards that we put in place are what we really need to be doing, or whether they can be improved upon. And again, this isn't so much for IT, but IT does play a role. We've got to get those business associate contracts in place. Those business associate contracts do protect you. It is part of the security rule. I think it should be under privacy, but it's under security. Those contracts be in place. And security, you also have some contracts that might need to be in place. If you've got a third-party IT vendor that is helping you out to make sure that your systems are secure, you need to have a business associate contract in place with them. If you have someone that is, if you use a cloud provider, cloud providers are also business associates. Go online and you can get their business associate contracts. But we always must make sure our business associate contracts are in place. And that is the first step, the first place we go in case there's an incident and it involves our business associate. Always go to the business associate contract and see who does what, when, and why. And how do we make sure that they're in place? Well, we have to make sure that we have somebody that's coordinating all these business associate contracts. Now we're going to go into physical safeguards next, and we're just about right on time because I was hoping to finish the administrative within an hour. Does anybody want to take a break, or do you want to continue on?
Why don't we continue on?
Okay, we can continue on. Let's do it. The next one is the physical safeguards, and this is more or less what your building is like. And the first one is facility access. And there are actually 6 key activities. You want to conduct an analysis of the physical security and their vulnerabilities, identify corrective measures, develop a security plan, develop access controls and validation procedures, also establish contingency plan operations so that if somebody who is supposed to be the one that opens the door isn't there, who's going to do it, and always maintain maintenance records. You always want to get credit for changes that you make, and you always want to make sure that you maintain all these maintenance records as well. So basically, the first thing that we always have to do is an inventory of facilities and existing security practices. What do you have? What is your inventory? Do you have cameras in place? Do you have silent alarms? What do you have in place? And what are the current procedures for securing the facilities, the exterior, the interior, the equipment, access control, maintenance records, etc.? And is a workforce member other than the security official responsible for the facility plan? So sometimes it's the security person, but sometimes you might have designated somebody else. And then always, what's the contingency plan in case something goes awry? So suggestions for implementation. We do this once a year. We walk our facility and we go around and we see where everything is, what the points of access to the building are. And we take notes of how accessible our systems are to the outsider. We are on 2 floors, the first floor and the second floor. And we did a little bit of work on the first floor because we were afraid that somebody could just break a window. So we reinforced windows. We take notes of non-technical threats, old electronic panels, low-hanging power lines, anything like that. We also look at where the security cameras are. We also reinforced our server room information and blacked it out so nobody can see it. They don't even know where it is unless we tell them. And then we also look at wireless access points so that, we don't want anybody to come in and plug in and get into our server information. And we always look at danger for low-lit areas, etc., that might cause hazards. So always walking around your building and seeing where the information is and looking at your fax machines, looking at everything, and then doing a physical assessment of your building is always a great idea. And then put it down on paper, say, hey, this is what the physical assessment looks like. And Charlotte, if you would like, I will send you a physical risk assessment so that you can see what we do and potentially use something similar to walk around the building with. So we'll send you that as well. And then what are the policies and procedures you have in place for the staff? I mean, we use key fobs now. And how many access points are there to enter into your building? And how do you monitor the equipment? So document and maintain records of everyone entering your building, why they are there and how long they remain in the facility. This is something else that, can always be a bit of an issue, especially with visitors. Do you have visitor logs, and how long do you keep those visitor logs? And what do you need to do with those visitor logs? So it's always an important thing to look at and see about that. And key activities, for that as well. Who needs access to the information? And what about disaster and backups? Because we always have disaster and backups again. And maintenance records of repairs to hardware, walls, doors, locks. And everybody needs to make sure we have these records kept, and where are they and who is responsible for that. Workstation use. This is the implement policies and procedures that specify the proper functions to be performed, the manner in which those functions are performed, and the physical attributes of the surroundings of the workstations or class. So the three activities: identify workstation types and functions, identify expected performance, and analyze the physical surroundings. So whenever we do this, we're actually looking at who is actually accessing the information and what information they are actually accessing. And that goes along with workstation security as well, which how do we get that access to the workstation, and how do we do the risk of each of those workstations and look at the physical safeguards as well. So when you put these two together, you're looking at not only where the workstations are located, making sure that they are not viewable by people walking by that do not have, should not have access. I know, Charlotte, I believe that most of your HR is kind of locked up in offices, et cetera. That's very good. But we always want to make sure that those workstations are secure. Device and media controls. We have to always make sure that when we have the device and media, the IT people, you know exactly where they are, and that you also have to make sure that if hardware is decommissioned, what you do with that hardware that's decommissioned, or that software, or that laptop that's been decommissioned. How do you destroy it? How do you pound it? What do you do to make sure that it's not reused by somebody that has no, that and has confidential information on it? Also, what do you do about USB drives? Those are really, really dangerous. Somebody puts confidential information on a USB drive, and then somebody says, hey, do you have a USB drive? And they just hand it over to them. It's not encrypted, and they see all this information. So we always must make sure that we know where our media is and how do we actually control it, and whether or not you have media devices that you actually have a log for them. But you need to identify and locate all media devices, whether they're removable or fixed. Create a tracking of your inventory, possibly by using barcodes. Evaluate what is acceptable for your organization for the disposal of the media, and document all media that's destroyed in this manner. So the Department of Health and Human Services can always come in and ask you, like, can you show us your media disposal list? Can you show us what you've done to destroy? We don't allow, to be honest with you, USB drives. We just thought they were too dangerous, so we don't allow them at all. Part of our acceptable use policy, you better not use a disposable media like that. With the regular consoles, we could block it. With laptops, when we send everybody home, a little bit harder, but that's where audit controls can also come into place. Develop and implement procedures for reuse of that. Again, you don't want to have people hanging on and giving it to them. So again, we'll just go through that one quite quickly, but you'll have all the information when you actually need it. And then backup and storage procedures. How do you back up the records, etc.? So we always have to make sure we do that as well. Now, technical safeguards. We're going to spend a little bit more time here than we did with the physical, but the technical safeguards are, really important for the IT folk to understand. And the first one is the access controls. And again, we talked about this when we talked about the administrative controls, who has access to the system, how does the HR department give you access, what access how does the IT department get that and then run with it so that they give people access to the right information. But here we're also analyzing workloads and operations to identify the access needs of all users, identify access control capabilities. How are we making sure that that access is only for those people? Ensure that all systems have been assigned to a unique user identifier. Develop an access control panel policy. implement access control procedures using selected hardware and software, review and update user access. And again, always we have to establish that emergency access procedure. What about automatic logoffs, encryptions, and de-encryptions, and terminate access if no longer needed? And again, that should also have an audit process attached to it. So how should the identifier be established and the length and the content? And should the identifier be selected or randomly generated? And this is when we're talking about a username or a user number for identifying the individual. So does the organization give the user identity to the individual, or do they get to establish it? We've seen organizations do either or. But again, everyone needs a unique user identifier so that we know who to go to for that. And then we have to ensure that all systems users have been assigned that unique identifier. So again, IT, you've got to determine what the format's going to be for that. We want to make sure that the user IDs are not public knowledge, and assign user IDs in an Active Directory along with passwords that require a reset at regular intervals. Now, again, how do we prove that we've done it? We want the documentation. They all should be identified and documented, and they should be in some form of Active Directory. The next is emergency access procedures. And again, what we're trying to do here is obtaining the necessary electronic potential health information in an emergency situation. So if one user typically has it, but that user is not available, how do we make sure that another user gets it so that they can continue the job functions? So the questions that we have to ask ourselves is, when should the emergency access procedure be activated? I mean, if somebody's off sick for a day, do you do it then? Or do you have a risk tolerance that it might be 3 days? Who is authorized to make that decision? Who has the assigned roles in that process? And will the systems automatically default to settings and functionalities? Or will that be individually authorized at the time of the issue? So always consider a variety of scenarios where your normal access controls will not be effective. Could be because of power outages or a new geographic location, or if you're using geofencing as an access control. But we always want to make sure that we can access that EPHI in those scenarios and train the employees on emergency procedures. And how do we know that it's done? Well, we've got documentation. We've got policies and procedures for that. Automatic log-offs. I mean, don't forget the rules were written in 2003. Automatic log-offs should be a given here. Are the automatic log-off features available for any of the covered entities' operating systems that have, access to PHI? If applications have been created or developed in-house, is it reasonable and appropriate to modify them to have an automatic log-off? What period of inactivity prior to that automatic log-off? What type of encryption is available for covered entities? And then, is encryption appropriate for storing and maintaining at rest? So we've got two things going here. The automatic log-off should be a no-brainer. I mean, in the olden days, remember, we used to always tell individuals the minute that you leave your desk, shut off your computer, and inevitably people forgot. Automatic log-offs were the outcome of that. Encryption, is one of those things that each entity has to decide on. I always, recommend that if you're doing anything in transit, there must be encryption. If you don't have encryption yourself, the TPA should have encryption. They should be able to send you something encrypted that you can return using their encryption. If not, there should always be some kind of portal or, secure portal access to the information. But anything in transit that's being shared across two organizations with a need to know under treatment, payment, and healthcare operations should always be going back and forth encrypted. There's always been this debate with encryption at rest. Is the server encrypted? We know that in the past, solid state computers with encryption were extremely expensive, and not all organizations could afford to have encryption at rest. The cost is coming down. So the organization has to decide based on your cost, functions, and availability and everything else, what kind of risk tolerance you have and whether having encryption at rest is important. Always choose a reasonable and appropriate method for encrypting EPHI at rest if you can. I mean, I would always say in transit you should. Implement the chosen encryption method, train employees to never leave their systems unlocked when they are not present, and push group policies to force systems to auto-lock after the inactivity, which we talked off with the automatic with that. Document employee training, document group policies, and document procedures. We do the training on the encryption. I will tell you, we have some built-in standards for encryption that if you have this, it's automatically encrypted. But maybe you want to encrypt something because of the confidentiality, but it doesn't fall into that box. We have a way of pushing our encryption through on any email that we do. And I always train people on that and say, this is what I want to see, because they need to know how to force an encryption is. Audit controls is implement hardware, software, and/or procedural mechanisms that record and examine the activity in the information system that contain or use protected health information. Where did we see this before? We saw this in the administrative as well. And we know that with the audit controls, this is where Anthem failed. So we want to always determine what activities will be tracked or audited. When any information is leaving, and like with Anthem and it went to unknown IPS addresses, we always need to know that. But we also want to be able to track anything that has protected health information to it. We want to select the tools that will be deployed to audit the system, develop and deploy the information system activity review or the audit policy, develop appropriate standards, and implement the audit system. So there's a lot of things that we have to do with audit control. But if you think of Anthem and what went wrong there, how do we make sure we're auditing? So we always want to make sure we do that with the auditing. Now, with integrity, it's the same thing. We always want to make sure that the information hasn't been altered or destroyed. So we want to identify all users who have been authorized to access the EPHI. We want to identify any possible unauthorized sources that may be able to intercept the information and to modify it. We also want to develop the integrity policy requirements. We want to implement procedures to address these requirements and implement a mechanism to authenticate the EPHI. So, you know, if the system has ever changed, we always want to know what happened before, see who changed it, and whether or not it was an authorized change. So how do we authenticate the EPHI? Some of the questions to ask are the uses of both electronic and non-electronic mechanisms necessary to protect the EPHI? Are there appropriate electronic authentication tools available? And are available electronic authentication tools interoperable with other applications? You know, when you have a third-party administrator, you might have the information and they might have the information. And if it's changed on one end and not changed on the other, that's always a good way to see whether or not, you know, with two systems, two people, that we have the information up to date. So suggestions is check some verification, digital signatures, and internal audits. And I mean, how you prove this, document the changes made to EPHI by capturing who made the change, when it happened, and what was changed, and document findings from the audits. You might need a third-party system to do this, a SIM system. But again, we always want to make sure that we know what's being changed in any given system. And then person or entity authentication. This is another implementation thing that we have to do. Determine authentication applicability to current systems, evaluate authentication options available, and select and implement authentication options. So we always want to make sure that, you know, the biggest thing is when we're sending it to in transit the information, that it goes to the right person at the right time, and that it's not being intercepted or modified. And this is where a lot of the encryption comes into place. We don't want to ever give out those encryption keys. We want to make sure that the transmission is secure and that we do implement the encryption. So what measures are planned to protect the transmission, and is there assurance that the information is not altered? Again, encryption will do that for us. So when we implement encryption, you always have to determine whether it's reasonable and appropriate for your organization. I would say in transit, it always is. Whether at risk, if it was at risk, would it protect your organization? Is encryption needed to effectively protect the information? Is encryption feasible and cost effective? That's where sometimes with REST it's not. What encryption algorithms and mechanisms are available? And does the covered entity have the appropriate staff to maintain the process for encryption? And are staff members skilled in the use of that encryption? So what we have for the proving of this is the documentation, the criteria used to choose the encryption standard, and the documentation that we have actually trained all our users on encryption. So that's basically the technical. There's not that many qualifications, but they are really, really, really important to make sure that we actually do protect the information. And then the organizational requirements, they come right back down to those business associates, which we talked about before. So you'll see with HIPAA, there is a lot of redundancy. We see redundancy when it comes to audit controls. We see redundancy when it comes to business associates. We see redundancy when it comes to incident reports and procedures. We see redundancy when it comes to contingency planning. We see redundancy when it comes to user identifications and usernames and passwords. That redundancy is there for a reason. It's because we want to make sure it's absolutely done. And if we miss it under one standard, it's under another standard. And that, it's also a way for the Department of Health and Human Services to make sure that it is actually done because of that redundancy. And if you're saying something under one standard and something different under another standard, they might come back and really worry about that. So those business associate contracts are really, really, really important. Now, there are certain requirements for group health plans as well. One of the things you always want to have with the group health plan is you want to make sure that you have plan documents that also talk about HIPAA, and that you are actually following the Health Insurance Portability and Accountability Act. And we should also put that in the summary plan descriptions as well. Plan documents should always address reporting security incidences, and they should always address business associate and subcontractors. Business associates quite often use subcontractors. So one of the things is, if you can check your plan documents and make sure there's some verbiage in those plan documents regarding HIPAA, that is always important. Now, one of the things that we have here, and I'll just go on and talk about it a little bit. You are a self-funded plan, so you are absolutely responsible for HIPAA. But you might have some plans that are fully insured, like a dental plan or a vision plan. They're still considered a health plan, but your carrier may be responsible for HIPAA. If you're only getting summary information from those vision plans and the dental plans, and by summary information, I mean who's enrolled, who's disenrolled, and just the amount of money that has been spent, and potentially what was spent on. We had so many cavities or whatever, so many fillings. That's summary information because it doesn't identify an individual. However, if you request more of a breakdown and you request information that regards the individual, then you also have to have in your plan document, and you have to give that fully insured plan carrier assurances that you will not use or further disclose the information that you receive in a manner that is not protected by HIPAA, that you will make the information available to the individual under the rights to access, as we talked about in the privacy training, that you will make it information that you will incorporate any amendments that the individual has under their rights. You will give them an accounting of disclosure, and you will make internal practices, books, and records relating to the use of disclosure available. So if you're receiving more than summary information on your fully insured plans, then you have to have this information also in your plan document. The other thing is that we always have to have in our plan document is that there has to be an adequate separation of duty. And we talked a little bit about this in the privacy rule. Basically, what happens in a group health plan is that the plan sponsor is usually the employer, and the plan sponsor is also somebody in the human resource department. And we always want to make sure that those two hats are completely separate. So information gleaned from the plan is not information that is used in any employment-related decisions. So, for an example, if you receive information from the plan that someone has cancer, that information that you glean from the plan is not then used for an employment decision where you're not going to promote them where you normally would have promoted them because they were doing such a great job. So we also always have to make sure that we wear those two separate hats. And it has to be documented if there is a human resource decision made and that you glean the information from the health plan. You've got to make sure that those are separate and that you had a right to make that decision under human resources, regardless as to what you glean from the plan. And again, that comes down to documentation as to adequate separation and how you're actually going to be doing this. So those are the kind of the things that we do have in the security rule. And again, we just wanted to make sure that, and again, we've come back to the security incidences. Now, they also have policy and procedures in the security rule. Anything that we talked about should have a policy and procedure to go with it. If you have an acceptable use policy that tells the employees how they are to handle it, you have a sanction policy to say what's going to happen if you don't follow the acceptable use policy. You have a policy for passwords. You have a policy for user identification. You have a written policy for incident procedures. You have a written policy for contingency planning. You have a written policy for patch management. Anything that you have to do in order to protect the system, documentation is really, really important, and you must have those policies and procedures to back it up. You must draft and maintain and update your policies and procedures as things change. Retain that documentation for at least 6 years. Nothing the Department of Health and Human Services likes to see more than, this is where we started and this is what we've done and this is where we're moving to, so that we're always looking at process improvement. Review and update your policies at least yearly, and whenever you make a change to anything in your system, make sure your policies are updated. So for an example, if you had been using 8 characters for a password with 1 uppercase and 1 lowercase, and now you're going and you're changing it every 90 days, and now you're saying you want everybody to have at least an 18-character password, that could be a phrase, that could have spaces in it, and that now you're only changing it every 6 months. If you've changed any of your policies, make sure that you update that documentation as well. So you've got to make sure that when the Department of Human Services comes in, that you have that data retention. So, and that you keep it for at least 6 years. And this is all documentation. So that's basically the security training. And as I said, we wanted to give you it in a format that you could actually take this and look at it and go through it and look at what you're doing. First step is always that thorough and accurate risk assessment. You always must complete that to begin with. Know where your devices are, know who has what, know who has access to what, and then start with each of the standards, where you are with those standards, and then look to see where your risks and your vulnerabilities are, which will establish your risks. Does anybody have any questions?
Michelle, this is Jerry. I don't, but I thought this was an excellent presentation. So I thank you. I know I learned a lot. We're doing a lot of things already, but there's a lot of things that we still need to do. So I thank you. I don't know if any of my team have any questions.
And again, we'll get you this presentation out today or tomorrow. And again, use it as a living, breathing document too. You know, take a look at it. You take a look at the steps, the questions to ask yourself, and where you stand and what you're doing to move on. And again, I really appreciate, working with you at Delaware, because, I mean, you have always just been, you're an organization that does want to do it right. And that's so important.
Michelle, this is Charlotte. I just have to ditto what Jerry said. I'm just in awe with this presentation. And I'm not a technical person, okay? But I just think that this was very, very well put together and presented. So thank you so very much.
Well, thank you, Charlotte. And again, we'll get it to you, and you can see how the NIST standards apply to HIPAA. And, just ask yourself all those questions when you're going through your risk assessment, and, but start with the risk assessment and start with that, because that's the most important thing to do. And if you've already had a risk assessment done, that's great. Go through the questions again and see what you might need to update. Okay, is there any other questions?
And Michelle, you will, when you send us the slides, you will also send the recording. Is that how that's done?
That is exactly how it's done.
Okay. Thank you.
I'll keep an eye on it, Michelle, and I'll send it out to the team.
Yes. And the other thing is, not only will I send you the recording, we'll send you the slide deck separate too, just in case you don't want to listen to the recording to go through the slide deck. So I'll send you the slide deck separate. We'll send you the slide deck and the recording. Charlotte, I'll also send you a physical assessment so that you can do a walk around your building, and we'll get all that out to you.
Perfect. Thank you
Thank you so much, Michelle.
Okay.
Thank you.
Thank you.
Okay. All right. Have a great day and be safe, everyone.
You too.
Thank you, everyone, too.
Thank you. You as well.